About the Affordable Care Act, marketplace insurance, Obamacare, whatever you want to call it. And whatever rose by any other name, I guess, right? Okay, so let's see here. So we're going to talk about that. Should take about 10 or 15 minutes. I'm just going to give a general overview of health insurance, basically before your Medicare starts. And then after talking about that, I will open the floor to any questions. So make sure you type your questions about anything Social Security, retirement, disability, survivor benefits, spouse benefits, uh, Medicare, Medicaid, the Affordable Care Act, and I will get to as many as humanly possible in our time allotted. So this is a live broadcast. If you're watching this later on in the recording, make sure you subscribe in case you have any questions and keep updated on all things Social Security and everything else, Medicare, Medicaid, the Affordable Care Act. Okay, so yeah, it's people get political when they get the different names, but I'm just going to call it Obamacare, whatever. That seems to be what everybody calls it nowadays. So, all right. So, what is it? So it was obviously it was a law passed many years ago that it requires insurance companies to make certain levels of coverage available. So, and people always ask about the mandates. There are no longer federal mandates since 2019, but many states do have mandates, which mean that if you don't have health insurance, then you're going to have to pay some type of penalty or extra, insurance or extra taxes or something like that. So each state, just, like a lot of things, each state is a little bit different when it comes to insurance. But there's no pre-existing conditions that ended. So anybody can get Obamacare. Um, and they're broken down into different tiers. You got bronze, silver, gold, platinum tiers, and there's an entire marketplace. That's another reason they call it the marketplace, because you go in there and you buy it on the marketplace. And the thing that has made it easier for people throughout the country to get health insurance, unlike prior, is these advanced premium tax credits. So the advanced premium tax credits just basically go with how much your income is. And it's your basically adjusted gross income was at line 11 of your 1040 there. And it looks at your income. And if your income changes throughout the year, then you need to update your plan, because basically what these are advanced tax credits. So if your monthly premium for a plan is $1,000, and then they look at your income, and if you need help with any of this, just let me know. And I've set up a network of people throughout the country that can now help you with Obamacare and get you set up with that before your Medicare eventually starts. Or if you're watching this and you're quite a bit earlier, then and definitely give us a call and we'll be able to help you out. But basically, what it is you're getting your tax credits next year early. So these are advanced premium tax credits. So basically, it looks at your income and it says, okay, your income is X amount, and sure, your premium is $1,000, but we're going to give you tax credits next year so you pay less in taxes. But we're going to give it to you this month. So instead of paying $1,000 a month, you're only going to pay $100 a month, for instance, for this health insurance for you and your family. And then if things change, let's say you say, okay, this month I'm going to only making, $2,000. So you get a premium. And then all of a sudden, 2 or 3 months down the line, you hit the lottery for $1 billion. Then when you do your taxes next year, they look at it and they say, okay, yeah, we gave you premium tax credits for those months, but then you made $1 billion, or you went back to work and you made a whole bunch of money, then that gets adjusted. At that time, you'll have to pay that back. So that's why it's important to always keep updated anytime your income reduces or increases, pretty much any amount or substantially, particularly substantially, because you don't want to have that surprise next April. And another thing that is available there is cost sharing reductions. So Obamacare Marketplace helps you with the premium, the monthly premium, depending on your income, but it also helps you with cost sharing. And what are these cost sharing? They help with deductibles, co-payments, and co-insurance. So again, this is income based. And if you're eligible for these, and you have to get a silver plan, one of the metal tiers, the silver plan, and then if you get that one and your income is at a certain level, they will help you with deductibles. So if you go to an MRI and it's in the particular plan you choose, it's $100 deductible, then the cost sharing might kick in and pay half of that or all of it. So, and then co-payments and insurance and all the rest of it. So when you're looking for a plan, just like Medicare, same type of situation, first you find a plan that takes your doctors and addresses all your medications and what type of health you go to the doctor often, you go to the hospital often, you do MRIs on a regular basis, or whatever the case may be. Look for a plan like that, and there's dozens and dozens and dozens of plan in pretty much every area of the country, and you look for a plan like that, and then you base it on that particular company and the monthly price, and hopefully we can help you out and get you a zero premium plan based on your income. And when can you enroll in Obamacare? Well, it's basically just like Medicare. The new plans come out in the fall. So you can change your plans for 2025 coming this fall. And there's also special enrollment periods. So if you have a new child, or you get divorced, or you get married, or you move, and there's all kinds of different special enrollment periods, then you can change your plan as well. So if you need help, make sure you contact us. Obamacare and Medicare, how does that work? If you have Obamacare and you are about to get Medicare, whether you're on, disability and you're getting it after 24 months, or you're turning 65, technically, legally, you can keep Obamacare. However, your subsidies go away. So that's a big thing. And if you don't get Medicare when you're supposed to, for instance, at 65, and you say, well, I've got Obamacare and, I'll just go ahead and keep that for a few years, I like it, then that's not credible coverage, and you're going to have to pay a penalty for Medicare. So legally, technically, you can keep Obamacare, but it's definitely not a good idea. So once you get 65, or you're at your 25th month for disability, then you should always switch from Obamacare to Medicare. And I hate talking about this part, but it's rampant throughout Medicare, Social Security, all of the clickbait and all of the fraud going out there. There's been a ton of fraud and bad actors over the last year. Basically, what has happened is you've got a bunch of very, very unscrupulous people, Obamacare agents, insurance agents, that do these Facebook ads or TikTok ads or whatever, and they say, hey, there's a super low plan in your area, click this button. And there's a bunch of small print down there that they put in there that you don't read. And then they have just gone in there and changed your plan. And they have taken over as the agent, and they get their commission. And one day you walk into your doctor's office and your doctor says, oh, we don't take your new plan. Well, new plan? I didn't do it. Yeah, well, you push that button. So Center for Medicare and Medicaid Services, the government has, so many people have complained, hey, I didn't tell anybody to change my plan. And so they complained, and they are coming down hard on these agents, which I love, taking their licenses, and so they can't sell anymore. So yeah, they're coming down very, very hard. So there's hundreds of thousands of people out there, millions, maybe, I don't know, of people that have kind of been subject to this fraud out there. And luckily, something is finally done about it. So if you know anybody, your family, friends, neighbors, daughters, sons, cousins, nephews, need any help with any of that, or any type of life change, new kids or anything like that, make sure they know that they do have to go ahead and change their their healthcare plan when they get those type of changes. And give us a call, email me, or call, and we can help you out just like we can with Medicare and all the rest of it. Okay, so that wasn't too bad, about 10 minutes. Let's go ahead and get into your questions on all things, everything. All right, let's see here. Got a question here. I am retired and single. If I marry a lady who's not an American citizen yet, does my Social Security income increase, and when? Thank you so much for your useful lecture. Um, she would have to have legal residence in the United States, a Social Security card. In order to get a Social Security card, she has to be a U.S. citizen or a green card holder. So, yeah, this is, people complain all the time. Oh, Social Security gives money out to, illegal aliens, undocumented aliens. No, that's, no, there's no Social Security, retirement, disability, survivor benefits, spouse benefits going out to people that are here illegally. I know because I've done hundreds of thousands of these claims, and that's one of the things we check is if you're not a U.S. citizen, you've got a green card, then we have to check the green card and run it through the INS, the G845, I think is the form, and confirm that you are in the country legally. So yes, she will have to get legal status. Doesn't necessarily have to be a citizen. She can be a green card holder. And if she's you marry her, she's your wife, then she can get up to 50% of your benefit amount. She'll get 50% when she turns her full retirement age. Let's see. John, what if you apply for Obamacare in December and you make 100K up to that point and then semi-retire at 63 and work part-time? How do they calculate your income? Is it backwards or forth? Yeah, that's why it's always important when you have changing income like that. So you do your best effort to estimate your income for the year, because yeah, and you're talking about December, so you're only talking about 1 month, so that's even more difficult. But if you're going to be making 100,000 for the next year, then it's pretty easy. You just put $100,000, and then we can figure out exactly how much in terms of premium, tax credits you get, and whether you get cost sharing and all the rest of it. And if things change throughout the year, then you need to update that. And again, so all of this is reconciled when you do your taxes. So if you estimate X and then you get a premium tax credit, and then when you go to file your taxes, then so no, wait a second, that was incorrect. Then you estimated too much, then you get some money back. If you estimated lower, then you have to pay some money. So yeah, all that gets rectified and made perfect-ish, as perfect as the government, I guess, can be once you do your actual taxes. Helena, hey, Dr. Ed, hey, what's up? All right, let's see here. Martha, I don't know if you read my other message. I'm really curious if I should be getting more if I didn't get all the benefits of time. Should I be getting? Please help me with that. Okay, yeah. Yeah, it's I don't know about the other message. I thought this thing is when before we even get started, I thought if you type the comments in there, the questions in there, I would be able to see it, but I guess it won't until the actual broadcast start. But yeah, if you got a question, Martha, let me know, and I'll see if I can help you out. All right, let's see here. Liberty 1776. Hey, it's been a while. Isn't Obamacare limited to what income you make? What if you make 90 gross a year? Yeah, it's you can get subsidies all the way from 100 to, was it 400% of the federal poverty level? So the subsidies and the premium tax credits are actually pretty generous. So yeah, if you're making a whole bunch of it, yeah, 90,000, you should be able to get some type of premium tax credits. I'm almost sure. It also depends on your family size as well. So it depends on how much you're making and your family size. And the family size is not necessarily how many people are living with you. It's your tax. So if you're living, in a commune, a 60s commune, you got 20 people in your house, but only 3 or 4 of those let's say 4 people, you've got you and your wife and 2 kids, the whoever you filed taxes on. So on your taxable household. So you don't care about those other 16 people, hanging out in your, barn. It's just the people on your taxes. So it's you, your wife, and 2 kids. So that's considered the household. So if you got your parent there, that doesn't count as part of the household because they're not on your taxes, unless they are on your taxes. So Cynthia, love Dr. Weir. Hit that like button. Yes, please hit that like button. Appreciate it. What happens if you sell your home to downsize on Obamacare? Yeah, so it's capital gains. I don't think are added on there. So it's was it number 11? Yeah, of your 1040. With Medicare, as you know, it does because Medicare includes a modified adjusted gross income. Um, but I put together a team of specialists that have been doing Obamacare for probably the best in the country on all of this. So Liberty, if you want to go ahead and see if you're in the right plan, please email me there and say, hey, here's my situation, and I'll forward it to my people in there. Yeah, they're the best in the country, I would argue. So it took me a long time to finally put together Obamacare, um, team, because I'm such a hole about getting everything right. So, how many happy, so many videos on YouTube helping. No, now I can only ever collect 82 and a half of hubby's social security. Yeah. Yeah. So it's okay. Yeah. So, but again, on the survivor benefits, the calculations are so difficult. And I think I've thrown, let me throw this up here again to give you an idea of, let me see here. Where is it here? Trying to find, okay, here's what's called the rib limb worksheet. So this is what Social Security employees, it's actually done by the computer system. So you have, the 82.5% of the deceased number holder. Then you have to go through this sequence of events and determine a low amount, mid amount, and a high amount in sequence 1, sequence 2, based on the 5 criteria above there. So super long story short, to calculate survivor benefits, if your spouse took benefits very early, it's extremely difficult. So I would triple check, Esther, and get a definitive number from Social Security, because one of the things about the rib limb, the widow's cap, is if you are under that, your benefit will not increase past 62 and a half. So there's a lot of people out there, unfortunately, that are 63, 64, and they think, survivor benefits, if I wait until my full retirement age, I'll get 100%. But if they're in that rib limb, that widow's cap, they won't. 62 and a half, they'll get 82.5%, and that's all they'll get. And so, yeah, they're missing a lot of checks. So once you hit 60, if your deceased spouse was never receiving benefits, then you're good. You don't have to worry about it. If your deceased spouse was receiving benefits starting basically at their full retirement age or after their full retirement age, you don't have to worry about it. If they were receiving disability, you don't have to worry about it. But if they filed very, very early, then yeah, it's good to check and have Social Security run the calculations. Kate, if I turn 70 in January, when should I apply for Social Security? October 1. When will it start? February. Should COLA for January? Yeah, COLA is automatic. They automatically do that to 70 million Americans at the same time. So don't worry about COLA. That's automatically started. So if you turn 70 in January, you're getting your full delayed retirement credits. So that month you turn 70, it's not one of those whole month type things. The month you turn 70 is when you get all your delayed retirement credits. So you should apply, yeah, a couple 3 months before is plenty of time. Particularly if you're already signed up for Medicare, you're already in the system, you're already in the claims path, as we used to call it. Um, they still call it that, but I'm just not there anymore. But yeah, it's super, super easy to start your benefit. So it should take no time at all, probably, 10 or 15 minutes to do your retirement application if you're already doing Medicare, because you've already done all the stuff. And so if you start your benefits in January, then you'll get your first check in February. Yeah. And you were born on January 26th. So you will get your first check on the fourth Wednesday of February. SSA 7162, is that the drop dead letter? Yes. Yes. So the drop dead letter. There's a what 7161 and the 7162. Basically, what he's talking about is if you live overseas, um, your your passing is not notified. If you live in the United States, coroner's office and funeral homes notify Social Security automatically of people's passing. That's often how people get, unceremoniously killed off erroneously, is some, you know, funeral home types in the wrong Social Security number, and then someone else, credit all of a sudden all their credit cards are closed. Um, So that's automatic if you live in the United States, but if you live overseas, it's not automatic. So what Social Security does is every year they send a letter and with that form, and you have to fill it out old school and send it out old school snail mail, to say, yes, I'm still alive. Don't stop my benefits. And if you don't send it in, then they will stop your benefits, and it's a nightmare to restart. So always send that in. Christine, if you are an SSDI when you turn 65 and are on your spouse's health insurance with 20 plus employees, I just want to make sure I don't have to sign up for Part B or D without it. Yep, you're good. Yes. If you are, even if you're on SSDI and you get, your Medicare starts at 25 after 25 months, same thing, same exact thing. If you have health insurance from work, yours or your spouse's, and that employer has 20 or more employees, then you do not have to sign up for it. You go ahead and get Part A because that's free, but you don't have to sign up for B or D. There's no penalty whatsoever. And then, a year, 2 years, 3 years, 4 years later, when you do stop receiving health insurance from work, then you just have to fill out a couple of forms. One of those you take to your HR, and the HR just, writes off, says, yes, this person had health insurance since they turned 65 years old. And that's how you prove, and there's no penalty whatsoever. Don Ricky, what qualifications are needed for an ex-spouse whose husband died before collecting Social Security and the wife is below age 50 with one daughter who is under 18 of age who they had together? Oh, okay. So this is a surviving child claim. Then the mother can collect also auxiliary or surviving child and care benefits as well if the child is under 16 or became disabled before the age of 22. Yeah, all you need is that child's birth certificate that proves that was the father. And if it's not on there, there's other ways to prove, the parenthood. DNA tests and all kinds of. There's some tricky ones there that, yeah, there's some very tricky ones in terms of trying to prove that relationship. So there's several ways. So there's a lot of people out there missing money here too, because they think, oh, well, the father who passed away didn't put the name on the death on the birth certificate, so I can't get benefits. No, 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 no. There's so many different ways. Um, yeah, I've told one story before that was pretty crazy, but we were able to get that child benefit. So yeah, there's so many exceptions, the exceptions, the exceptions. If my ex owes me for back alimony, court order, can Social Security deduct it from his Social Security retirement? Yeah, I think I had a question like this yesterday in my YouTube comments. Someone, the ex was collecting benefits. Wow, this is a shot in the face, isn't it? The ex was collecting benefits on her record. So I guess they got divorced and he never really worked a whole heck of a lot. So he collected his little bitty amount, and then he filed for spouse benefits on hers. And all those years, I think he didn't pay alimony or child support. So that was, yeah, I was just like, wow. But Now, you had difficulty getting alimony and child support before because you couldn't garnish any wages. Person didn't work, or they worked under the table, or whatever the case may be. But now that person is getting above board money, federal money. So go back to the court and tell the court, says, hey, this person is now getting Social Security money, and the court will send a garnishment order to your local Social Security office. We used to get those every single day. We used to have one person that was in charge of that, always did a good job. Yeah, they'll garnish those wages. And if you're ever on the other side of that, if you're ever your Social Security wages are ever garnished, we used to have people all the time. They come down there and says, "Hey, I just went to court, and the alimony is over, the child support is over, or they reduced it from $1,000 to $500, and here's the court order. Can you reduce it?" We're like, "No, no, no, you can't. We have to get the court order directly from the court. So you just can't take your papers down there to Social Security. It has to be officially from the court, because needless to say, we've received, yeah, doctored documents." Cynthia, you only have to sign up for Part A until you come off the spouse insurance. Okay, all right. Thank you, Cynthia, for answering questions there. Then apply for Part B, then sign up for supplement plan, not advantage plan experience. Yeah, I'm a big fan of the Medicare supplement plans as well, if you can fit it within your budget. I wish more people could fit it within your budget, but Nina, I'm 67 years old with severe impairment, no work experience since 1997. At 62, I started getting my ex-husband retirement benefits. How can I get so? Let me go down a little bit here, see if there's currently getting my ex benefits. And I have some serious severe impairments. Can I get SS? Um, no, you can only, in your particular case, you can only get disability based on your own work record. And if you haven't worked, you had to be currently insured, which means you had to work 5 out of the last 10 years. And it doesn't look like, well, you might. I would, where was it? I'm trying to go back up here and find where this comment was. Okay. All right. So you're 67. You haven't had any work since 1990s. Okay. Yeah. So that's definitely, yeah, there's no 5 out of the last 10 years there. So no, unfortunately, you can collect disabled widow benefits from 50 to 60, but it has to be widow. But unfortunately, no, in terms of that. But you can file for SSI, supplemental security income, but it takes your regular retirement benefits into consideration. The most you can receive on SSI is $943 a month. So if your regular Social Security benefits that you're receiving now are over that, close or over that, then you wouldn't be qualified for SSI. If not, I would definitely apply. Definitely apply. All right. Let's see here. I wanted to know why Social Security did 2 reviews within 2 weeks when I told them I was going to work 7 hours a week, and they didn't give me 9 months trial work period. Yeah, I've no idea. Yeah, that's somebody messed up. Yeah, 2 reviews within 2 weeks. Somebody duplicated the paperwork and send out the short form or the long form twice, or the local office sent it out, and then sometime the regional processing centers activate their own CDRs. So 2 ships passing in the night. You get one from the local office and you get one from the processing center. So that might be the case. So yeah, if you're in your trial work period, then you can make all the money you want. You still have to, if you're doing the ticket to work, then they won't do a CDR. But if you're in your trial work period, they can still do a CDR. But yeah, they definitely should not do 2 of them. So I would, you probably already sent it in. So I would probably put on there, it says, hey, this is second time I got this form. I wound up not being able to work, but it was scary. Yeah. It is my understanding that Obamacare goes by MAGI, but it's different MAGI than what Medicare uses premium. Yes. So yeah, Obamacare goes mostly with the Aggie part of it, the adjusted gross income, and Medicare, particularly what not necessarily, yeah, the premiums, the extra premiums go for MAGI, the modified adjusted gross income. So the Medicare also counts like capital gains and municipal bonds, and foreign income and stuff like that. Um, Obamacare, does it have better coverage than Medicaid? Um, no, about the same-ish. It really depends on your state. There was, Medicaid expansion. Some states could expand their Medicaid to, beyond people with, that were pregnant or disabled, or some states decided to expand Medicaid. Other states, don't tell us what to do, and whatever. Um, in terms of medical coverage, they're similar. They're supposed to cover the same type of things. That's what's part of it. Part of the entire act to begin with is to bring a little bit more uniformity to health insurance. Because before this, insurance companies could deny you if you've got any sickness. Oh yeah, we don't want you, and they could deny you, and now they can't. And there has to be some level where it's like, okay, yeah, we'll give you insurance, but we won't cover this, we won't cover that, we won't cover this other thing. So Obamacare changed that as well, and Medicaid has been doing that. So, and Medicaid is a state federal program, so they still go by federal guidelines. I'm 67 and currently getting my ex-husband's retirement. Oh, okay, all right, already answered that one. um I signed up for Social Security benefits online, but it won't let me submit the application. Just says hold on processing. Yeah, not sure. Regular retirement, usually those are pretty easy to go through online, so not sure what's going on there. Will SSA help with finding a supplement and or Medigap plan? No, they will not. Social Security employees know nothing about prescription drug plans and Medicare Advantage and Medicare Supplement. They get zero training on any of that because all of those are private companies. And so, as federal employees, they are not supposed to, make any type of recommendations on anything like that. Private companies, that'd be a conflict of interest. And same thing, do you need an attorney? And Social Security employees are told, you don't say anything. If people want an attorney, don't say yes or no or whatever the case may be. Which attorney should I get for my disability claim? They don't, Social Security doesn't say anything like that at all. So no, Social Security will not help you with that. But we can. So email me, give me a call. If just leave a voicemail with your name, your phone number, your state, because they're all state specific, and then tell me what you need help with, and I will have someone, one of my awesome people, contact you and help you out. Is a rotator cuff injury considered a disability? It would have to last 12 months or longer, keep you from working. If you're, I guess, if you're in a Cirque du Soleil show and you're one of the trapeze artists and stuff like that, possibly. I have an issue with SSA about SSDI. They changed my onset date. They are trying to get out of pain. Um, Yeah, if they change your onset date, you can always request an appeal. I did a video about a month or so ago on disability and the entire appeals process. So if you disagree with anything, any type of decision, you can always appeal it and have someone. Let's see here. If wife claims Social Security at 62, then at 67 claims 50% of spouse, would it be 70%? Okay. So yeah, if the wife claims early, so her benefit is reduced, but she doesn't file for spouse until her full retirement age, then she gets 50%. So, if she took a reduction, let's say the 50% of yours is $1,000. If she took hers early and she's getting $300, when she hits her full retirement age, she'll get $700 from you. So if she took it a little bit, later, she gets $400 from her own. Then when she files for spouse benefits, she gets 1,000 from you, but minus her own. So she'll get 600 from you. So that's basically how it works. All right, let's see what I can. How can I consult with you? Yeah, I've got very, very limited appointments that you can go on to any of the YouTube videos. And in the YouTube videos, it's got a link there for my Calendly link so you can schedule an appointment. Let's see. Daniel, if you turn 65 and have other health insurance, is there any reason not to sign up for Part A? The only reason not to sign up for Part A is if you have a health savings account because of tax issues. If you have a health savings account, then you can no longer contribute to your health savings account. You can still have a health savings account. You can still take withdrawals from your health savings account, but you can't put any more money into a health savings account because the health savings account is, tax, benefits there. Um, and when you have Part A, you can't have HSA at the same time. You can't contribute to the HSA at the same time. And actually 6 months prior to that, because when you sign up for Part A, there's kind of like a 6-month retroactivity period there. So if you're going to sign up for Part A, you need to stop contributing to your HSA 6 months before. And if not, the IRS is going to have some issues with you. Esther, live chat is very helpful. I've been able to help friends with some questions. Feel for the people trying to navigate. Yeah, great, awesome. Yes, please share. There's hundreds of millions of dollars out there of people that are, just don't know about it. And once they know about it, tell them to come on, and we'll inform them of those benefits out there. We'll tell them the tips, tricks, and secrets of how to get it and how to fight Social Security and get the money you're entitled to. That is my new mission in semi-retirement. Donna, I'm looking to retire or go part-time next year. I'm 62 now and have no commodities and do not take any medications. How much would my insurance be if I'm making 30,000 part? Yeah, so too many variables there. We'd have to run it all up. And it depends on the plans in your particular area and what type of plans you want. And yeah, so it really depends on, the level of plan you're looking for, and then what type of subsidies we're looking at to offset those. But email me. There's my email on the screen, or call and again leave your name, phone number, state, and say, hey, I want to kick around my Obamacare options, and I will have someone give you a call and go over all of those options. Nina, I have a small amount, $360 a month. Also, I have 10th grade. Oh. So yeah, if you're only getting that amount, I would definitely 100% file for SSI, Supplemental Security Income. So call Social Security, and not sure why they didn't do this when you file for spouse benefits. They should have. So file for SSI. Let's see. Antonio, receiving SSDI, I'm getting compensation payments for 150 weeks. If I choose a lump sum payment, will it offset my SSDI payments? All right. So, so it sounds like it's like a workers' comp type thing. If it's just a private disability, then it doesn't matter. Doesn't affect your SSDI at all. If it's a public workers' comp, PDB, it's public disability benefit, through a state or government or something like that, then it will offset your SSDI. But if it's, workers' comp from a private company, it's not an issue. If it's, some long-term disability or something like that, it's not an issue. It won't affect your Social Security at all. You must sign up for Part A, then other insurance stops. You need to sign up for Part. Okay, all right. Answering my questions there. Awesome. Appreciate it. Let's see. What happens? I'm on SSDI at the age of 55. What happens when I'm at retirement age? Funny you should ask. I just did a video. Let's see if it's released. I think it releases. I put it up a few hours ago. Let me check. I just did a video, and that talks about that. So, but basically, yeah, it is up there. So it's Social Security at 60, 62, and 65. So it's got 600 views. Yeah. Anyway, I should have blown something up and got more views. But anyway, what are you going to do? But yeah, once you hit your full retirement age, nothing happens. Um, your disability benefits automatically switch to retirement benefits. But there's certain things you should do. Watch my video that I just put up, and it'll tell you, check to see if you have any survivor benefits, any spouse benefits. Once you hit 65, check out your Medicare supplement options because you can't get Medicare supplement in most states when you're under 65. But now that you're 65, you can. So I would definitely check that out. Imagine I became a member yesterday. I do not get notifications when you're alive. I think you have to click the little bell thing there. I hesitate to tell people to click the bell because I'm putting up so much stuff. They're just going to hear the bell ringing all day long, and so I don't want to do that. So most people say click the little bell for notifications, but I never really say that because I'm trying to put all of the information up there in easily accessible way. So it takes a ton of videos, and I'm trying to put a nice library up there. So I'm doing a lot of videos. So I don't want to annoy people. So there's that. With Obamacare versus Medicaid, I think it depends on what plan you choose. Yes, exactly. That is a fact. But they all, they all have a minimum, set of standards that they have to abide by. And it's, yeah. I was going to compare it to a Medicare Advantage with all the pre-authorizations and stuff like that, but I think I will just stop there. Yeah. Thanks, IR man. No, okay. Imaginator, you've been hanging out here for a while and you just signed up. All right, I'll let you slide this time. 37 likes. We need some more thumbs up. Yes, please, more thumbs up. This is how we send this information. Esther, learning my phone and live chat, not sure how to do the thumbs up. All right, no problem. I had if I start part B at 65 and then move overseas at age 67, can I postpone plan B or do I pay part B forever, even if I'm not in the United States? Yeah, I mean, you can stop your part B anytime you want, but remember when you restart it, if you decide to come back to the United States and restart it, then you'll have to pay a 10% penalty for every 12 months you did not have it. And if you're overseas for a year or two and then you get sick, invariably what happens, you get sick in April, May, or June, and you can't start your part B until January. You can sign up in January and your part B will start February. So if you come back in April, May, or June, and you get sick, you're going to have to, pay everything yourself for 6 months until your part B restarts. And then again, you'll take the, penalty forever. This man will be an asset in the future of my Social Security adjustments. I'm still 64 and will be drawn early, so I have to watch out. Be it make much of that. Yeah, there's a. I think I've heard that about 1 billion times. I wish I'd known this or that, and because I got the same thing when I actually worked at Social Security. People came in at 65 or 67 or 70, and I tell them this, and they say, "Wow, I wish somebody would have told me that a year ago, or 2 years ago, or 10 years ago, or 20 years ago." So that's one of the reasons I took my early retirement is to get that information out there because Social Security is doing a terrible job of getting this information out there. What is the best age to retire to receive full benefits? Well, to receive full benefits is your full retirement age. So, if you were born after 1960, that is 67 years old. But what is the best age to retire? It's too many variables. Whether you need the money, how healthy you are, your genes, all kinds of different things. Yeah. Do I have any recourse if Medicaid now requires me to pay a spin down? A spin down is usually when you've got some resources and you have to spend that down. Maybe you're talking about like a cost sharing type thing. Yeah, if they have made the determination that because of your income and resources that you have to pay the first $3,000 as a deductible for your Medicaid, and you disagree with that decision, absolutely, you have appeal rights. So appeal it and say, no, I don't agree with your decision to make me pay X, Y, or Z. Um, but yeah, and if you've a lot of people are losing Medicaid or being put into lower levels of Medicaid. And because of that, they're also losing their Medicare Advantage dual eligible plans. Those are the ones with, a whole bunch of extra benefits and, goodies, depending on your area. Um, and yeah, if you lost your Medicaid or your Medicaid has been downgraded, then you have a certain amount of time to switch to a regular Medicare Advantage plan. If you don't, then one day you're going to walk into your doctors and get something done. You're going to hand them your card and they'll say, well, this has been canceled. So make sure you find someone that can help you out. If you don't know anybody you know and trust, reach out to us and we can check out, see what's available in your area. Angie, my husband was on SSDI for a year, just ended last month. He was denied permanent disability, even though they acknowledge they can't continue doing his job. So, yeah, this sounds like a closed period of disability that he filed a while ago and they said no or something and they changed their mind and said, okay, all right, we should have approved it. But then you became undisabled, you were able to work. So, same type of thing. If any Social Security, any government decision like that, you can appeal it. So if he can no longer work because of his disability, he's not working over SGA, then 100% appeal it. So if this is your first level of appeal, it's pretty easy. Just do an SSA 561, very short little form. It's only got 2 or 3 lines in there to write your stuff. If you've got a longer, a description of what your issues are, just, type them out or write it out in a piece of paper. And on the top of the 561, just put, C attached, and then submit that to your local Social Security office. It is in your best interest to make the investment and becoming a member. Trust me. Thank you. Thank you. Team is always looking out for us. I just asked to start healthcare through the government website. I spoke to them by phone, chose a plan, and then the insurance company I chose was supposed to send me a material card and a bill. All right, good deal. Okay, never mind. Instead, I got a letter from Medicaid saying I need to send them a bunch of paperwork and call them for an interview. Oh, okay. So yes, so this is actually a pretty good thing that they're being proactive. So you signed up, you were going to sign up for Obamacare, or, Affordable Care Act, and you look for a plan and yada, yada, yada. But the numbers you put in your particular state, they said, wait a second, maybe this person is eligible for Medicaid. So I guess they're doing the right thing there. Yeah. So they reached out to you and say, yeah, it looks like you might be eligible for Medicaid. And because Medicaid is a welfare based program, yeah, you do need documentation and stuff, but that might actually be better for you. So yeah. Nina, you're fraud, retired, you don't qualify for disability anymore. Yes. All right. If you're on disability, do they ever give you a Medicare earlier than 24 months time frame? Yeah, if you have end-stage renal disease, Lou Gehrig's disease, there are some that give you Medicare quicker. And why is that? Because certain politicians pushed for that. So I'm going to do a video later this week. And if I was a dictator for a day, and if I was a dictator for an enlightened dictator, okay, anyway, yeah, that's one thing I would say change is if you're on disability and they approve you for disability, why do you have to wait 2 years to get health care? So you should get it immediately. But anyway, um, just got then I got something from the insurance company saying they won't send me information and details on the plan or the card until I have to pay them. Yeah, so you have to do you actually have to pay the premium before the insurance company will start your benefits. Absolutely. But it looks as though the state is taking action on your Medicaid. So yeah, it's you know but Medicaid might take a while, so I would contact them and say, hey, I just got a bill. How long is your process going to take? Is it going to be quick enough? Or Am I going to be without health insurance for a month or two while you make your decision? Should I go ahead and start this, the plan I chose, go ahead and pay for it so I have insurance for a month or two? And then if I do that and you approve me, will you pay me back? And so, yes, I would definitely check that out. All right. Let's see here. Go for any questions. Jackie, is there Medicare supplements in North Carolina? Yes, absolutely. All throughout the country. There's some states that are kind of strange in terms of Medicare supplements, like Massachusetts, and different places. But yeah, North Carolina, absolutely. So if you want some quotes on your Medicare supplements, either a Plan G or a Plan N, or you want to kick around both, email me and tell me the state you live in, your name, phone number, and say, hey, give me some quotes on G and N, and we'll have someone reach out to you and give you some quotes so you can make your decision. Let's see here. Can I also draw on my ex's Social Security if I currently draw on my own? Absolutely. If your ex's benefit amount, primary insurance amount, which is their benefit at their full retirement age, if that's over twice years, you can collect spouse benefits. So, and the important thing is, don't just look at, if you talk to your ex-spouse and your ex-spouse, yeah, I get $1,000 a month, and you say, well, that's not twice as much as mine. That person might have started drawing early, or that might be after Medicare is deducted. So don't look at that number. You need the primary insurance amount. Again, there's probably tens of hundreds of millions of dollars out there of people that call their ex-spouse. How much are you making? Oh, okay, I'm making this. Okay, that's not twice the amount, so I guess I can't collect any benefits, but they can. So yeah, the easiest way to do it is call Social Security and say, hey, I want to file for benefits under my ex's. And if you don't know the Social Security number, no problem. Just tell them the name, the Social Security employee, tell them the name and their date of birth and where they were born and stuff like that. And they'll be able to look it up. And if there is more money there, they will set you up an appointment. If there is no more money there, they will not set you up an appointment because there's no money. But remember, here's another thing: hundreds of millions of people, or hundreds of millions of dollars are being lost. Is people call, like for instance, what's your name? Syrup. Anyway, so they call, and at that particular time, their ex's benefit amount is not over twice. So they call, and the Social Security employee says, no, you're not entitled to benefits. And that's all they say, which is wrong. Because what they should say is, your benefit amount is not twice, or is not less than half of your ex-spouse's. So you're not entitled to benefits while that person is still alive and kicking. However, survivor benefits can get up to 100% of that benefit amount. So if anything ever happens to that person, then you might be eligible for benefits on that person's record, depending on your married status and all that kind of good stuff, marriage status. So yeah, a lot of people just, oh, I'm not entitled, and they think they're not entitled forever. And more, yeah, or so much money out there. People are losing so much money. So please subscribe, like, share on Facebook, and all that kind of stuff. He does not call back. He does not email. Yeah, I 99.9% of my help is through these live chats. I do have a couple appointments, a few appointments a week that I do private calls, but I have to charge for those. If you need Medicare help, absolutely. But I get hundreds of calls and emails every day. And yeah, I mean, it's unrealistic to think I can respond to all of those. Why can't Medicare be like Medicaid, one plan and that's it, but pay for the whole thing? Well, Medicare is like that. It's just Part A and Part B, and that's it. But yes, I understand what you mean now. But they also have the Medicare supplements, and yes, I know what you mean. Yes, you got the Medicare supplement, Medicare Advantage, and the Part D, and all that kind of stuff. Yes, I agree. The whole thing is way, 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 way too confusing. My husband just passed away. I showed Social Security the death certificate. Now I am waiting for a phone appointment. Okay. Yeah. Sorry to hear that. So, yeah. So it sounds like you weren't receiving benefits on his record. If you were receiving benefits on his record as a spouse, everything is automatic and you really didn't have to do anything. But I guess your benefit amount wasn't less than his. And so therefore you weren't on his record. So. My husband is 67 years old and still working, also has Medicaid. Must he apply for Medicare? Um, yeah, I mean, if he has Medicaid, and he doesn't already have Medicare, he should get Medicare at 65, but that's no problem. But I would have him reach out to the state Medicaid office and say, hey, why don't you all pay for my Medicare Part B, sign me up for Medicare so you can have both. And then you can get a Medicare Advantage dual eligible plan, which are really good for people, depending on your area, for people that have Medicare and Medicaid. But if the state doesn't want to sign him up for Medicare, then he's good with just Medicaid. I got it immediately after waiting 2 years to get my disability. Ah, yes, yes, yes. You get because you waited your 24 months. It's just that it took 2 years to get your disability started. So your onset date was 2 years ago, and then you were on disability for 2 years, and you got your Medicare immediately. So I guess you did get it immediately, but it took you 2 years to get it immediately. Yeah. Hi, I'm 65, intended to sign up for Part A only. I work full time with a HSA. Shall I do not delay? Yeah, if you're going to continue, if you want to continue contributing to your HSA, then yeah, don't even sign up for Part A. So delay. But if you want to take out the contributions, but you don't necessarily want to contribute, then you can go ahead and sign up for Part A. But it sounds like you have health insurance from work, so you definitely don't have to sign up for Part B. Let's see. Medicare is nothing like Medicaid. We have paid into Medicare for many years. Yes, that is a fact. Oh, so if he divorced in 2011 and he passes, I could apply for survivor benefits. Yeah, if you were married to that person for 10 years or longer and you're currently not married or you got remarried after 60, absolutely, you can collect benefits, survivor benefits. Yep. If that benefit amount is higher, absolutely. How to avoid IRMA on house sale trust. No, yeah, it's capital gains, and there's a certain threshold of profit from capital gains, but yeah, there's no way, unfortunately, to avoid it. I, I always say you can appeal anything, and I think in one video I said you can't appeal the house sale in Irma, and someone said, "Well, you could appeal anything." I guess, well, okay, yes, you're right. You can appeal that, but they are denied 100% of the time. So, because I have no idea why Congress didn't make that exception to where, okay, high income, but this is a once in a lifetime sale of your home, and you're just downsizing because you're filing, going into retirement. But Congress just didn't make that exception. I have no idea why they didn't do that. Let's see. It's kind of funny how we never think about retirement till the last minute. Then we panic and want to know everything all at once. Yeah. Well, it's you're actually doing 100 times better than most. When I worked at Social Security, I would, go out into the lobby and call my 9 o'clock appointment and call them back. And I think they just started thinking about retirement while they were waiting in the lobby for me to call their name. I mean, that's how unprepared they were. It's like you've been, waiting for over 60 years for this. I figure, but yeah, it's interesting. All right. Oh, I think I've missed a few. Let's see here. They got something from the insurance company. Okay. Hey, just Jeff. My phone alarm is off. I'm jumping around here. I'm trying to find some new people here. To file from an ex, they had to have been married 10 years, correct? Yes, but not necessarily consecutive. You can, if you remarry the same person the following calendar year, You can add those times together. Jacob, I helped my dad today with the Social Security. That's what we like to hear, Jacob. He is currently 62. Mom passed away this year, but he was unable to collect for survivor benefits because mom only had 13 points. Yeah. Yeah. So that's correct. He's 62. So he's collecting benefits on his own record. Um, and if he was ever married to anybody else prior to that for 10 years or longer, he could conceivably receive divorce spouse benefits. But other than that, then, you need to figure out what type of health insurance you can get for him until Medicare starts at 65. So, and then again, I just did the thing on Obamacare. So if you need help with that, yep, come on and send me an email and we'll have someone reach out to you. I filed for SSDI in 2012. Social Security unposted one work credit and gave me SSI, then finally posted the credit after 8 years. By the time my medical records did not exist and said could not use. Wow, that's a wow. So yeah, that needs to go up to an administrative law judge. So hopefully that was a recent decision, and filed the 561 request for reconsideration. They'll probably deny it, and then do it's a 501, and to get a time to see an administrative law judge. That's something an administrative law judge really needs to look at. So yeah, that doesn't sound good at all. I'm 65 now, so if I wait until March 2025, will I get the full Social Security benefits of my ex? Yeah, if well, you if that's your full retirement age, but it's probably not your full retirement age. Your full retirement age is probably 66 and however many months. So, but yeah, if that's your full retirement age month, then yes. How do I know if I have been collecting everything I can? Stay tuned to this channel. Watch, I wouldn't say watch my over 400 videos, but yeah, watch the ones that are appropriate to you. Hello, can I receive my deceased husband's Social Security at 64 and switch to my own at 66? Absolutely. And that's what a strategy I often recommend is go ahead and file for survivor benefits. And if you file for spouse benefits and that person is still alive, then you have to file on your own record first. But survivor benefits are different. You can file for survivor benefits, get that amount, don't touch yours, let your benefits increase. And then once your benefits are at a higher amount that you like, then switch from survivor benefits to benefits on your own record. And in terms of Medicare will start automatically whether you're on your own or survivor benefits. If you go ahead and sign up for survivor benefits, you'll get your Medicare card in the mail about 100 days before you reach 65 years old. All right, we are over the hour here, so let's call it a day, a night. And so if I think I got pretty much all the questions. What is the status of the HR 82 Social Security Fairness Act? Yeah, that's going back to the old 1970s, how a bill comes a law. A lot of those things are just some politicians trying to pander for votes, and so they say, hey, I'm going to give you, I did a video on this, I'm going to give you free ice cream and unicorns, vote for me. And then once you vote for them, then they completely forget about it. So that's one of those. It ain't there until it's there. So if you like it, then definitely support it. But was it just them pandering to get votes and then they're not really serious about it? So I guess that's a decision you have to make. All right, y'all have